So what are the most common side effects of hormone therapy?
Well, there's the three big ones are loss of muscle, which causes fatigue, loss of libido, which is loss of sex drive. It doesn't mean incapacity to have erections because men can take Viagra. And the third one is a slower metabolism and a potential for weight gain. Those are the big three. I talk about those as the big three because those are sometimes the hardest to manage. There's a lot of other things such as osteoporosis, breast enlargement, dry skin, other things that we have treatments for and generally don't present a problem if the doctor managing it is expert enough to know how to prevent them.
In regards to breast enlargement, how do you mitigate that side effect?
So there's a medicine that blocks estrogen, FDA approved for the treatment of breast cancer called Femara. It's very effective, 1 pill a day. Other things that can be done, a little bit of radiation to the breast area will prevent the breast enlargement. So with those measures, that doesn't usually present a problem.
Okay. So in regards to fatigue, how do you handle that?
So the number one thing that I always get men to sign in blood at the beginning of their treatment for hormone therapy is to start resistance training with weights, preferably under the supervision of a trainer. And if men will commit to that type of a program, say 3 days a week in the gym or under supervision, lifting weights, they'll feel pretty normal throughout the treatment period. Those that compromise or take holidays will lose muscle so fast it'll make their head swim and they'll feel tired and fatigued. And then you have to crawl back up the mountainside again. So weight training is the number one thing I emphasize when men go on this treatment.
I know one thing I've heard you've mentioned that I've also seen work for a lot of men is also getting a personal trainer to help keep them accountable.
Yeah.
I've seen that be very effective in many, many patients.
It helps. It's not an easy thing to accomplish, and having someone to encourage you and supervise you makes a big difference.
So when it comes to the loss of libido, do you have a certain set of suggestions for the patients that they can pay attention to in order to kind of help maybe their relationship or the process?
Well, we certainly want to advise the couples. Sometimes the spouse may not realize that the man's change has nothing to do with their relationship, has to do with just the hormones. And then also because people's libidos are low, they forget that they need to get regular erections throughout the time period that they're on the therapy. So low libido doesn't mean that men shouldn't be taking some Viagra and maintaining normal sexual erections on at least once or twice a week basis. Otherwise, atrophy can set in.
So something I don't know that we mentioned is hot flashes. I know that we did a survey with PCRI, and it showed that I think about 90% of men who experience or are on hormone therapy are experiencing hot flashes. So what can they do to mitigate that? Is that normal, that the hot flashes are normal, and is there anything that they can take?
There are things to take. Sometimes men are a little fed up with taking so many pills and they just endure the hot flashes. They're not dangerous. Sometimes they're so intrusive that people have trouble sleeping at night. And if that happens, medicines, there's an antidepressant medicine called Effexor, small dose, 37 milligrams can be helpful, or another medicine that's used for sometimes for seizures in small doses called Neurontin can help with hot flashes. Acupuncture can help with hot flashes. There's a need for better medicines. None of these measures are 100% effective. The most effective treatment is estrogen. Usually we give a small patch, an estrogen patch, and that'll make the hot flashes go away. But then there is a little bit of risk of breast enlargement then. So it's a tricky area, and we're still hoping for new and better agents to help men in this area.
Thanks for watching. If you would like more information about any of the topics we discussed today, you can go ahead and visit our website at PCRI.org, and go ahead and subscribe to our YouTube channel. We post new prostate cancer videos every week.